Pacifica Salud Hospital, Punta Pacifica, is a leading private healthcare facility in Panama City, renowned for its advanced medical services and commitment to international standards. As the first hospital in Latin America and the Caribbean affiliated with Johns Hopkins Medicine International, it offers world-class care to both local and international patients. We're honored today on Behind Closed Doors to introduce Mike Kelly, the International Client Relations Rep for Veterans at Pacifica Salud Hospital. Y'all, we back. And we're answering the questions that you asked. So I just want y'all to stay tuned. I'm Glenn P. Brooks Jr. This right here is Cherie A. Brooks Jr. And that guy, is a great friend that has all the information. If you're a veteran and you're trying to figure out healthcare and navigating the best options in Panama, that's your dude. That's Mike Kelly. And we'll be back with Behind Closed Doors with the Brookses right after this. So I just want to welcome all of you guys back to what really is an exciting edition, Cherie. We asked Mike to come to the table today because you guys have been asking questions relative to healthcare and veterans and Panama and how to navigate it. Now I'm going to say this on the front end. We're going to give a soft introduction really quickly to who Mike is, because many of you guys, if you've been friends of our channel for any length of time, you've seen this guy before on several occasions. You've seen us out at his ranch. You've seen us hanging around. You've seen us in Casco Viejo. You've seen us hang. Mike was one of the first people that we met prior to coming to Panama. At that time was really heavy in the relocation business. And he was our real estate broker, and he was the one that found us our spot in terms of where we live today. He and Stephanie and the kids are friends of ours, and today he's serving in a very different capacity. He's a former owner of a clinic over in Panama Pacifica, and having divested his interests there, he now finds himself here at Pacifica Salud, and I'm telling you right now, the role that you're playing is helping so many veterans, Mike. But before we get to you, Cherie, did you want to have anything to share?
So I just want to have you guys get a pen and paper ready so that you can take notes, because Mike is going to share some very vital information that you need when it comes to the top healthcare options for veterans in Panama.
So Mike, really quickly, if you can, and I know I just did a little soft introduction, talk to us a little bit about your passion, man. We know you to have a heart of gold, a huge heart for people, and to make sure that their transition to Panama is flawless. You were doing health relocation tours for a minute, still to some degree are doing that. Can you talk to people a little bit about, like, why are you here and how do you serve them?
Definitely. First of all, thank you. I always love doing this with you guys, and you are more than friends to me. You guys really are family.
Yes.
And so it's gone beyond just a friendship.
Sure.
We go back quite a bit.
Yeah.
And I'm just glad that I've been able to experience this with you guys pretty much along every step.
Yeah,
for sure.
I mean, I've been in healthcare for about a little more than 10 years here in Panama. So I started in Panama Pacifico. I was part owner of a medical center. It was a primary care healthcare facility. We had a full service lab, radiology, imaging. We had full-time doctors on staff. And it was really geared to primary care for anybody, but we had quite a big population of English-speaking patients that were expats or veterans. It kind of became a niche for us in the sense that, in the expat community in Panama, the word kind of spreads about things like that.
We're going to ask you guys, if you have not subscribed to the channel, please go subscribe to the channel right now. Mike's information is in the descriptions below. If you have questions, Start loading them up now, because what I do want to do is when this premieres, we're going to be in the chat answering many of these questions if we possibly can. So as you're seeing this, we'll be live. We're live in the chat to be able to engage your conversations and things like that.
Right, and so Mike, real quick, before we get into the details, the nitty gritty of the insurance, so you went from being co-owner of that facility, and now you're here at Pacifica Salud, so.
Yeah. Well, it's been a journey.
Yes.
Let me tell you that. So I started to organize tours, which would basically, I called them a health tour, but I would organize appointments with specialists, doctors, whatever, people would call me, and whatever their needs were, I would tailor it to their needs.
Right.
It would include tours of hospitals, but I created such a network, and I'd gotten to know so many doctors and health specialists, and just everything related to medical care, that I was able to put together these tours that hadn't ever been done.
And so let me just jump in real quick. Mike is really like playing this down. And so you guys have heard me talk about when I fractured my ankle. So Mike is the angel who got me an appointment the next day with the orthopedic surgeon. So when he says he has a heart for this, he's passionate about helping people with their healthcare needs. I mean, he has been hands-on in helping people in various situations get the care that they needed, because when you move to a foreign country, you don't know who's who. You don't know who to go to.
Right.
And you don't know all of the intricacies of how this system works. And one thing that I want to caution people, when you go to another country, their system does not work the same as it does in the United States. We're very accustomed to, you go to the doctor, you might pay a copay, and you get a bill on the back end. So we're going to start with that. We're going to go in, Mike. Yeah. You're not going to get a bill here because you're going to pay up front.
Say it again.
You're going to pay up front. So
one more time for the people in the back that didn't hear that.
You're going to pay up front. Now, the cost of medical care here is significantly less expensive than in the States, but that's something that people need to be very aware of. So you came here, and your title, the position that you're in now, is some long title. I don't know what it is.
It's a whole long title. I am the International Client Relations Manager, and basically what that is just I manage all health programs for English speakers. You can call it for expats, but veterans going to fall into that category. Pacifica Salud is affiliated with Johns Hopkins Medicine. It is really, if you're coming from the United States and you're looking for a hospital, you're probably going to find this one first, just because
it's familiar.
It's familiar. It's got a great reputation. It's not, one thing is to be affiliated with Johns Hopkins Medicine, another is to have a reputation to back that up.
Yes.
I mean, it's not just that. I mean, it's the top quality, the best medical specialists in the country, most cutting edge technology, robotic surgery, everything is done here.
The big question is for disabled veterans. A lot of veterans come here that are on disability, and we are enrolled in what is called the Foreign Medical Program, FMP. And so at other facilities here in Panama, we aren't able to use those benefits. And so how has Pacifica Salud stepped in? What benefits are available to those that are in the FMP program, and how does that work here?
Yeah, good question. So, I was brought in, took over managing veteran services, and that was organizing all of these benefits, getting the word out that you can use your military benefits, including the Foreign Medical Program. But not only that, creating an experience that goes beyond just going somewhere to use your benefits.
Right.
I mean, it's, we're not the only hospital that is a provider for the Foreign Medical Program, but my goal is that we provide a better overall experience, and that's really what my focus has been, and so far I think it's worked very well.
Right.
And so when you're retired veterans, if you're a disabled military veteran, whether you're retired or not, you can have coverage under the Foreign Medical Program. That is VA, so it's basically the same as your VA benefits, where in the United States you can walk into a VA hospital and you're covered for everything.
Right.
It's a little bit more limited outside of the United States. So it works in Panama the same way it works in any country outside of the United States. So the first thing you need to do is register for the foreign medical program, and you can do that easily online. Once you're registered, you basically will get a letter. It's the letter from, it's the VA letter with your disabilities. And the way that it works here is that you are covered 100% for all service-connected disabilities.
Say that part again, please.
You are covered 100 completely for your service-connected disability.
For service-connected disabilities.
That means that any, if you're rated disabilities on your VA letter, which is in Panama, your foreign medical program letter, the VA will cover that. So it's through the foreign medical program covered by the VA.
So just for clarity, just want to be very clear because I get this question all the time. So if I'm a disabled veteran and I have 4 disabilities that I'm approved for, I can walk in the door of this hospital and be seen for that. Do I have to pay anything up front? Do I have to come out of pocket? Or how does that work?
No out of pocket. The only thing that you do have to do is register with the hospital. So once you're registered with the foreign medical program, you bring in your documents. So we're going to ask for your VA letter that has your disabilities listed on there, and a form of ID like your military ID, your passport. We need your social security number, and a lot of people get nervous about that. It's not that we need it, it's just what the VA requires.
VA,
yeah,
right.
So they require social security. That's basically your client, your patient
ID,
number.
right,
Yeah.
right.
And so that's a requirement from them. So, when we ask for your social security number, it's, don't worry. And
Right.
that's, and so we, we provide this service according to the requirements of the VA.
So, as a disabled veteran, I fractured my ankle. Now, that's not a service-related condition. I don't have me regularly fracturing my ankle as an approved condition. So in a case like that, if I had an emergency that was not related to my service-connected disability, how then can I receive services here at Pacifica Salud?
I would love to talk about that.
Okay, let's talk about that.
That's a great question. And also I should clarify that whatever you have on that list, anything that is related to that, like caused by that. So let's say you have a knee condition or a heart condition or PTSD. Some of the most common disabilities that are listed on your letter. If you come in for something that's not directly, it's not that, but it was caused by one of your listed disabilities, then that is also covered. So it doesn't have to be, it's not just limited to that in the sense that if it was something directly caused by one of those.
Right. So if it's a symptom of that condition,
if it's a symptom,
or it's something connected
if
condition.
if it can be connected directly to your disability.
And the doctor identifies whether it can be connected. It's not me saying, well, I fractured my ankle because I was having an anxiety attack, and so that should be covered.
That's right.
Oh, okay.
So the doctor, but and we have our staff here is very good at determining if it's going to be covered or not. I have support staff here that have been doing this for a long time. So, it's, if it can be covered, then it will.
Right.
But to get to your question, if something happens and it's not related to one of those conditions or one of your disabilities, we will definitely admit you in. But you do have to pay. So in private hospitals in Panama, in order to be admitted, you do have to pay. Now, sometimes, especially in an emergency, it's not like we know what it's going to cost you right away. That has yet to be determined. Right. So if it's not covered by your foreign medical program or any other kind of insurance, then you would be asked to put down a deposit. That deposit could be, $1,000, could be $500, could be, it just depends. Right. And the reason being is that we need to ensure that the services that we're going to provide can be paid for. If you put down a deposit of $1,000 and the bill comes out to $500, then we just refund that additional $500.
So do I have to have $1,000 cash when I walk in the door? I need to stop at the bank before I come to the emergency room?
Another great question. Absolutely not. No,
Okay.
you would never have to show up with cash on hand. The most common way is really with a credit or debit card.
Okay.
So, you just, use your credit card, put down the deposit. You can do a bank transfer. So if you have a local bank account, then you can just do a quick transfer. It's really easy. So yeah, those are the most common ways to put the deposit down. But again, it's just, we want to make sure that, especially if you come in as an emergency, to get you stabilized and checked out and let the doctors diagnose what's going on.
Right.
We just ask for a deposit that we know will cover that cost, and then go from there.
Yeah.
And whatever, if anything's needed further, we communicate that with you. There are never any surprises.
Right.
And so, if for example, if you were to come into the hospital and it turns out that you need some kind of major surgery, you don't have any insurance to cover that. Let's say you require like a heart surgery,
Right.
that will, and you'll have to be in the hospital for an extended period of time, then, we're gonna tell you, like, this is what's going on.
Right.
It's gonna cost around this much.
Right. Right.
Do you want to stay here?
Right.
Got it.
Right. You have the option.
Yeah, and so, we let you know so that you can make that decision. And if and there are public hospitals in Panama City, in the event that, you just can't pay for it.
Yeah.
There are public hospitals that you can go to in those situations. So, the decision is ultimately yours. In some situations, you actually go back to the United States, especially for retired Americans that have Medicare.
Right.
If you're in that kind of situation, the best option might be to just get stabilized here.
And then go back.
Go back to the
Yeah.
United States.
Yeah.
Have it covered.
And you're covered by your Medicare. So
Yeah.
that's, with Americans with Medicare, that's a really good option. That's why you always want to maintain
Right.
that coverage that you have.
One thing I want to just kind of jump in really quickly. One, if you guys are just jumping in and maybe you're just tuning in the channel, welcome to Behind Closed Doors with the Brookses. I'm Glenn P. Brooks Jr. This is my wife, Cherie. And we're sitting here with Mike Kelly, and he's a great friend, but incredibly knowledgeable when it comes to veterans benefits, particularly for those of expats who are moving from the U.S. We wanted to get into some things. If you have not subscribed to the channel, do so. But Mike, one of the things, please do so. One of the things that I wanted to ask, and Cherie is a disabled veteran. I have Champ VA. And I know that there are a lot of veterans who, maybe the spouse is, say, 100%, disabled, but the one of the spouses, and then the other is, has TRICARE or Champ VA or whatever the case may be. Does Pacifica Salud accept TRICARE or Champ VA or other military-related insurance plans for retired veterans or dependents? And if so, what services are typically covered?
Yeah, that's a good question. And I've always, at this time, Pacifica Salud does not accept TRICARE or Champ VA. And the reason why is because it's been really hard for hospitals here to really kind of deal with TRICARE. It's a complicated procedure. There are a lot of cases where the hospitals aren't getting paid.
Right.
And so when I came in here, I did not want to jump into that without making sure that we weren't going to have any of those situations. I have been really working with TRICARE and just making sure that some of those issues get resolved before we jump into that.
And let me just speak to that real quick. So I know a lot of people have asked about the TRICARE and Champ VA, and there are hospitals, other hospital facilities that will say they accept TRICARE and Champ VA. I want you to be very cautious when somebody says they accept it, because oftentimes what they mean is that they will submit a claim for you, but you still have to pay out of pocket, and they'll submit your reimbursement for you. So last question, we're gonna wrap this up. When it comes to preventive care, are expats able to come and utilize services here at the hospital for normal routine medical care, connect with doctors here at the facility?
Absolutely. Yeah, we have every kind of doctor and specialist that you can imagine at this hospital. So whatever doctors you need to see, I can set that up So I'm usually the point of contact where, if you need routine, annual checkup, your preventative, checkup for the year, I'll get you set up with any doctor that you need. We're going to soon have a general physician on staff that actually is going to be focused on veterans and expats.
Okay.
But right now, we have general physicians that have offices here that can help with that. We have a full service clinical lab, x-rays, ultrasounds, MRIs, CAT scan. We have all kinds of options available. So, you would just contact me. I'm usually the point of contact for, expats and veterans, and I can get all that set up for you.
Oh, and one last thing I want to add before I turn it over to Glenn. And the doctors, the majority of the doctors here are English speaking.
Yeah.
And so you won't have problems with any language barriers when you come and get care here.
That's right. Yeah. So
Even if you do, Mike can be your translator.
Right.
Yeah.
So that you know.
And that's part of the VIP service
Absolutely.
that I'm working on creating. And in a sense, it was already there, but I'm really just improving it, and based on my experience.
Right.
So when you come in here, you have English speaking customer service. So when you come up, you're speaking there's someone there that's going to greet you and get you set up in English. Our doctors speak English. Whether it's a planned checkup, for your annual maintenance or your annual maintenance.
Your annual maintenance,
Whether-
your maintenance,
yeah,
your monthly
for
maintenance.
sure.
It's like an auto shop or
Yeah,
something.
you better maintain.
Yeah.
Right.
Or if it's for just something punctual, like
Yeah.
you want to see a urologist or
Right.
a gynecologist or whatever it might be. I mean, it's all available here. So it's just a matter of getting in touch with me or my team, and we'll get all that set up for you.
So that you guys know, all of the information that you need in order to be able to get in touch with Mike, we're going to definitely put it in the descriptions below. Any last things you want to share before we roll out?
No, I'm just grateful for you taking this time to sit down with us. Hope you guys took notes. Stay tuned for updates on things that are happening here. Once we get you connected with Mike, you'll be able to get those updates on as they're making changes and adding new services for expats and veterans here. But thank you for taking this time to meet with us.
Oh, thank you so much for doing this, and subscribe to the channel first thing. Do not forget.
Listen, guys, y'all already know what time it is. At the end of the day, you cannot get to any place of significance by yourself, and the reason is because we all need some help. Y'all be good, and we'll see you on the next edition of Behind Closed Doors with the Brooks.
Brooks.
Viva Panama!